Okay, then let's talk about Adrophonium test, right? Adrophonium test. Before getting to Adrophonium test, let's understand what is Adrophonium, right? Adrophonium is nothing but it is a carbamate. What is carbamate? It comes under the category called carbamate, which is an anticholinesterase. Now, what is anticholinesterase? First of all, before that, you need to understand what is cholinesterase. Cholinesterase is nothing but it is an enzyme which is involved in breaking down of acetylcholine into acetylcholine, right? So cholinesterase does that. So anticholinesterase just inhibits that. Now edrophonium is a sort of anticholinesterase which inhibits cholinesterase. So in turn it increases the acetylcholine concentration. So adrophonium does this, right? So now let's get into adrophonium test. Now why do we need adrophonium test? Using adrophonium we are doing some test. Okay. That is for diagnosing myasthenia gravis and differentiating myasthenic crisis versus cholinergic crisis. Now it is, I know it is bit confusing what is myasthenic crisis and cholinergic crisis and all, but for differentiating this thing, like the second one we'll understand in another video, but for now we'll understand how it is helpful in diagnosing myasthenia gravis, right? Now before that we'll understand what is myasthenia gravis. I hope you know it is about myasthenia gravis. Myasthenia gravis is nothing but it is autoimmune disorder wherein our own auto antibodies are blocking the NM receptors, due to which acetylcholine are not able to bind to the NM receptors, and muscle contraction is inhibited. So muscle weakness is usually seen in myasthenia gravis. So got it right? Myasthenia gravis is this. Now how do we diagnose myasthenia gravis? We do it through Adrophonium test. We'll see how we do it, right? So a patient came to you. If you're a doctor, then he's talking about some weakness, muscle weakness. The patient doesn't know about what, like, why that weakness is, what is the reason behind that weakness and all. You need to find out, right? So how you will find out the how that, like, what is the reason behind that weakness? So Adrophonium test helps in this case, right? So let's see how it helps. Now Adrophonium test, let's see. What you'll do is you will give that patient IV Adrophonium, that is 2 milligram IV Adrophonium, and you will wait for 45 seconds, and you will see his muscle weakness will improve. I'll explain you what is this, right? Adrophonium, you know, adrophonium is anticholinesterase, so it will increase acetylcholine, right? It will increase acetylcholine. If the patient has myasthenia gravis, yeah, you know myasthenia gravis, right? Myasthenia gravis, the receptors are completely blocked. But when you increase the acetylcholine to certain extent, when you increase that, the acetylcholine may there are few NM receptors where acetylcholine may bind, right? So this acetylcholine helps in this case, like Adrophonium does that, increases acetylcholine to certain extent that the muscle weakness improves, because there are other NM receptors which are not blocked by these autoantibodies, where this Adrophonium can bind, and like that, sorry, the acetylcholine can bind. Now this increase in acetylcholine causes this thing, and acetylcholine can freely bind to other NM receptors, so muscle contraction is seen. So the muscle weakness is improving. This, what do I mean by improving muscle weakness, right? It's nothing but the muscle weakness is resolving. That is nothing but the muscle contraction is good, right? I hope you got it right. Now this second thing, giving him again 8 milligram of Adrophonium and waiting for 45 seconds to see that his muscle weakness is improving and all, this is just a confirmatory thing. First you have seen that, and just you are confirming it again by giving 8 milligram. So this regimen may differ at different places, so just have an like understand this concept, right? Why it is causing improving of muscle weakness and all. This test is called ameliorative test also. Now ameliorative is just a fancy word. I also searched in Google about it, what is ameliorative. It is nothing but to make someone feel good or to make someone good, right? So by this test we are just improving the patient's disability, or not that, like the patient's muscle weakness is getting better, right? We are giving patient something feel we are making that patient feel good by doing this test. So that's why it is called ameliorative test. Now why I am giving such a different fancy name to it, because there is another test called provocative test. Now it is not in use, but what is provocative test? It is nothing but we don't use Adrophonium over here, rather we use NMJ blockers. Now what are these NMJ blockers? You know, right? NMJ blockers are nothing but they inhibit the NM receptors on the muscle, right? On the muscle they inhibit the NM receptors and acetylcholine can't bind, right? So NMJ blockers, what we are doing is, by giving NMJ blockers, what we are doing is, we are worsening the muscle weakness. That is nothing but, normally the patient came with muscle weakness. He is saying that I can't lift my hand, it is like it is really difficult, I'm feeling very weak, his muscles are really weak. So if you give NMJ blockers, it will further block the, already if he has myasthenia gravis, already his NM receptors are completely blocked. Now if you give this NMJ blockers further, they'll further block the rest of the NM receptors, right? They'll further block it. So you'll certainly worsen his muscle weakness, not is rather, instead you'll not improve his muscle weakness. You know, Edrophonium, how Edrophonium does it by improving the muscle weakness, you're not doing it here, right? In NMJ blocker you're just worsening the symptoms. So that's why it is called provocative test. You're provocating the patient unnecessarily, you're provocating the patient by worsening his symptoms. That's why it is called as provocative test. By giving Adrophonium, you're just making that patient feel good, so it is called as ameliorative test. So differentiating now, provocative test is not at all in use. Ameliorative test is what we usually use in hospitals right now. So that's about Adrophonium test. I hope you got how we diagnose the patient came with muscle weakness, but is it myasthenia gravis or is it something else? How you'll know? Through Adrophonium test. I hope you got it. Let's in the next video we'll see how to differentiate myasthenic crisis versus cholinergic crisis. It is really interesting, so stay tuned. Till then, goodbye.